Emmanuel was born with not just one, but two congenital conditions. He is the 1 in 10,000 people who is born with a rare condition known as situs inversus totalis, where the organs in his chest and abdomen are arranged in mirror image of normal human anatomy. A normal heart leans towards the left, but Emmanuel's heart leans towards the right. He was also born with a narrowed heart valve, which results in low oxygen levels and may have long-term complications affecting brain development, growth, and activity if he remains in this state for a prolonged period. To fix this, Emmanuel had to undergo an open heart surgery before he turned 1 year old. As his heart was not in the usual position like the rest of the population, the doctors printed 3D life-size models of his heart so they can visualize and rehearse the procedure. His operation was a success, and he is now doing well, needing just biannual checkups. Like Emmanuel, 66% of all congenital heart abnormalities need surgical correction. The more severe the condition, the sooner the surgery needs to be performed. Sometimes, surgeons even have to operate on newborns to ensure the best outcomes for them. About 15 to 20% of all cases may need to undergo several surgeries when the young patients outgrew the previous implanted devices.